legalization of recreational marijuana has become a hot topic here in Pennsylvania. Our own Lieutenant Governor is currently on a statewide tour talking with voters about the merits of legalization. But this issue is not as simple as whether or not it should be legal for adults. There's at least one major segment of the medical community that believes legalization of the drug would contribute to an already problematic level of exposure our teens have to marijuana. With that in mind, I sat down with two Pittsburgh area young people to talk to them about their experiences with marijuana. I was surprised to hear what they had to say.
I started smoking marijuana when I was 12 years old.
12? That's pretty young.
Yeah. Real young.
Laura is a 21-year-old Pittsburgher who has been smoking marijuana for almost 10 years. How often do you smoke?
Every day. I smoke every day of my life. Wow. Multiple times a day.
She says none of her friends were smoking when she started, but she's certainly not alone. We spoke with another area teen with a similar experience. Marcus was exposed to marijuana at the ripe old age of 11. How old are you?
12.
12 years old. And when did you start smoking?
Like a year ago or so.
How did you get introduced to marijuana?
I was at a playground. Like a whole bunch of people came that were smoking, and I just like joined this up.
Kids your age?
Yeah, I'm a little older.
Okay. So at the time, you're 10 or 11 years old.
Yeah, I was like 11.
In my clinical practice, I see adolescents turning to marijuana for a number of reasons. Social connection, dealing with anxiety, depression. These are just a few of the reasons I see people begin to smoke. What was the good part about it?
It's just like everything like chill and relaxed and like calm.
Laura, however, is clear about the fact that marijuana was a choice she made in order to replace her mental health medication.
No, I don't use medications for my mental health, and I can't even look at a pill bottle anymore because of past experience with medications. Really, I just want the diagnosis so I can get a medical marijuana card and know what it is myself. That way I can like work through it. Marijuana's helped me because I can get depressed or anxious or have panic attacks or have PTSD flashbacks or like I'm bipolar, so that it's like a constant roller coaster.
One of the things that's most striking to me is how little knowledge our young people have about the impact of marijuana on the developing brain. When asked if Laura was concerned about these side effects, she was quick to respond.
I know there are negatives to marijuana, but the positives for me, I mean, it helps me get up and like do everything that I need to do every day and like clean and go to work. And it really gets me up out of bed instead of making me want to just sleep all day.
What if I told you there were concrete physiological issues that come from smoking marijuana as a teen? Would that change your opinion at all?
No, can't see any. I mean, honestly, if I would have any physiological issues, it would be because of antidepressants, not because of marijuana.
So you're saying the other medications they gave you, they had negative physiological effects, and so you'll take marijuana over that stuff?
Yes, any day.
That was only one of the things she felt strongly about. When asked about legalization of the drug, Laura had an emotional message for legislators.
I've been through so much stuff in my life that like this one little thing means a lot to me. So, it's a lot. And I really wouldn't have even been able to come out today or like do this without smoking. So, it calmed me down enough and like made me a well-rounded enough person to make friends. Because I've done a lot of stuff in my life that even I regret. But pot's definitely helped me become a better person.
It's clear that Laura, along with many of our teens, would like to see the legalization of recreational marijuana. The American Academy of Child and Adolescent Psychiatry, however, is leery of that idea. In fact, the AACAP has issued a warning. In their recently published report, they warn that the legalization of marijuana could be associated with a decrease in adolescent perceptions of harmful effects of the drug, increased use of the drug among caretakers, and an increased adolescent use of the drug, all of which they believe could lead to problems. So, you be the judge. Is marijuana the miracle drug that some of our teens seem to believe it is, or the mind-altering substance that some child psychiatrists are warning about. Perhaps the truth is somewhere in the middle. Only time will tell. And as we learn more, we'll bring you more here on House Call. Here with us to talk about this issue is longtime drug and alcohol therapist and licensed counselor, Dr. John Masella, and Pennsylvania attorney and longtime cannabis advocate, Patrick Nightingale. First of all, thank you for coming to House Call.
Thank you very much for the invitation.
Not a problem.
So, Dr. Masella, I'll start with you. In my practice, I've been seeing an increase in the number of teens that I'm seeing that are regular marijuana users, sometimes daily smokers. Is it just me, or is there a trend?
No, I do believe that there's been an increase in youth and young adult smoking marijuana and smoking more regularly. Some of that, I believe, is associated to the idea that marijuana is not addictive, which is one of those myths that has been around for quite a while, and that the idea of people being able to move to that as a specific drug of choice or a replacement drug if they've been using other controlled substances at higher levels, which is probably one of the reasons, or may have contributed to people moving towards use of marijuana for treatment of IV narcotic or opiate dependence. I have seen an increase in tolerance, quantity, and or frequency of usage. Some of that may be directly associated to cultural issues, as well as the kind of quality of the drug. We've seen a remarkable increase in the potency of marijuana now, and I think that part of that has stemmed from the medical marijuana usage in population, and the belief that if they have some semblance of control over that, then they have a better control over the usage itself.
Right. But Dr. Masella brings up something that I wanted to ask you about, Patrick. What I've seen over the years is there seems to be a level of misinformation about marijuana on both sides. There are folks who think marijuana is the devil and it's this awful thing, but then there are the folks in the kind of cannabis community that think marijuana is this miracle drug. It can't be addictive. It's a cure-all. What do you do to combat that misinformation?
Well, one of the things that we talk about when we are advocating for full legalization, right now HB 50 is pending in the Pennsylvania House of Representatives. Senate Bill 350 is going to be introduced soon, and both of those bills are calling for full adult use legalization. And that is our starting point. We're talking about responsible adult use of cannabis. This is not, opening the door to teen cannabis use. We believe that education is very important, especially as we're moving forward with what we hope to be a successful progression through Pennsylvania's legislature to bring adult use reform to Pennsylvania. One thing right now that we don't have is we don't have revenue from legal marijuana sales being redirected to teen drug education. We have in the past seen the DARE program, for example, and I am not a addictions expert by any means, but anecdotally speaking, the DARE program seems to have resulted in more young people being exposed to drugs and thereby being interested in drug consumption. Right. And interestingly, recently the DARE program has completely eliminated marijuana from its discussion because it is simply not sustainable. I would draw a distinction with the notion that it is a, quote, gateway drug, because the gateway drug theory came from a study of people who are hard drug users and asked them what was the first illegal substance that they used. Correlation is hardly causation, and that's something that I think we need to continue to have a responsible discussion about. But absolutely, for marijuana reform advocates to pretend that there is no potential downside to full legalization is something that I don't think resonates when we are trying to engage with people who are skeptical, people who are critical, and especially if we're talking about the issue of teen marijuana use. We need to at least acknowledge the elephant in the room that yes, a young person's brain is developing.
Right.
It could be continued to develop as late as 25 years old. That's why we saw the United States Supreme Court rule that mandatory life sentences for juvenile offenders who are convicted of murder is unconstitutional,
Right,
because you
right.
can't, hold someone to that same level when they were 16 years old as potentially when they were 30 years old. So these are important issues that we need to discuss. We need to be realistic and understand the critiques and the criticisms that we encounter. But what I always come around to is, yes, this is a psychoactive drug that can have an effect on the developing brain, just as alcohol can have an effect on the developing brain, just as nicotine consumption can. Adderall or other prescription drugs that are routinely given to young people, people under the age of 18. And it is not an adequate justification to say, because this is a possibility, we need to continue to arrest and incarcerate and prosecute and subject Pennsylvanians or Americans to the criminal justice system, because we are a little unsure about how this will play out with teen use. And while we do need to have this discussion about the realistic effects of adult use legalization with young people, with DUI, with traffic fatalities, with other cultural issues and societal issues, we are coming from the starting point where it's illegal right now and we're arresting you and we're putting you in jail for it.
Right.
Like, again, if that's the barometer, then every single bar should have law enforcement posted up outside of it to arrest every single person that comes out of that bar after consuming alcohol, because it's the exact same issue. What's that person going to do? Is that person going to, cause themselves to have some type of mental health issues? Is that person going to engage in reckless behavior?
Right.
We know with alcohol, for example, that it is a very potentially destructive substance. Alcoholism is real. DUI fatalities, domestic violence related to alcohol, aggressive and other violent tendencies related to alcohol. Yet we acknowledge that in a free society, this is something that the government does not have any interest in absolutely prohibiting.
I want to look at some of what the American Academy of Child and Adolescent Psychiatry is saying. They're talking about the long-term dangers of cannabis use for teenagers. So in other words, they're using cannabis, their brains are developing, they could have lasting impact. The studies are showing things like sexual victimization, increased sexual victimization, increased driving issues, increased intellectual issues. And so what do you say to the teen who says marijuana is not a problem, it's harmless, it's natural, and so I don't see a problem with smoking every day? What do you say to that kid?
Well, I think one of the things that's a big standout, and let me kind of carry on some of what you were discussing. There are some well documented and clearly researched dangers associated to excessive use of marijuana, like other types of controlled substances. And the thing that has stood out more and more for me is that, and what I've seen and what research supports, is the earlier someone starts to use, the more likely they are to have increase in their tolerance more rapidly. And the means of intake has a clear impact upon how aggressive something progresses. And let's get honest, most teens, youth or young adults will smoke marijuana. And even though there's been legalization associated to use of medical marijuana to treat chronic pain, other types of disorders, PTSD or what have you, is there really a need to smoke your medication? And that's always perplexed me, because you're adding a means of intake that I think can be increasing with respect to damage and COPD, other heart conditions. And so those are the things that we sometimes would do well to look at and address. And one of the first things that a person signs when they go into get medical marijuana is a form that they acknowledge, and usually on the first line, that know and understand that marijuana is an addictive substance.
Okay.
And yeah, I do agree that like alcohol and what have you, that there have been problems. And I absolutely see and have often said that if you bring alcohol to the market today, you need a prescription for it. And for me, that doesn't make it okay. I think that because we're looking at adults, we're looking at increasing access, period. because when there's open access, adolescents are going to get it in
Right.
some way, shape, or form, especially from adults that believe that it's okay. Look, it didn't hurt me. I think it's okay for my kid to use. How many parents have you worked with in your private
Yep.
practice that would say things like, look, I'd rather them drink at home or smoke at home because I know where they got it.
Yep.
And then I would
Yep.
tell them, yeah, well, where'd you get it? And so the idea of saying that, you know, this is something that we're looking at for adults and is going to be something that can be positive and effective. You're adding another drug to be abused on top of the most widely abused drugs in the United States today already: nicotine, alcohol, and prescription opiates,
Right.
and which overtook benzodiazepines.
Yeah.
So the drugs that are most widely abused in the United States are all legal. And
so
I
you're
get
saying
concerned with that.
You add marijuana as one of the legal drugs,
you're-
you're just going to add access. You're going to increase the
I
access.
absolutely believe that you'll increase access.
Yeah. And so would you legalize marijuana? If it's up to you, you get to decide all by yourself.
I would not legalize marijuana.
You wouldn't?
No, because my opinion is that regardless of whether it's for adults or youth, I mean, you're going to increase the access of it, and I don't want to make it any simpler for someone to get a drug. Now, will the penalties increase? I mean, that I'm not an attorney. I'm not familiar with the legal system in that regard, and if you're asking me what my experience has been, the people that have possession or what have you, most of my clients and that have been arrested or what have you or busted, the legal implication has been de minimis. So it's unless they're carrying pounds.
Right.
My experience has been, and I'm not again an attorney or working in the criminal justice system, has not been that remarkable.
Okay. I have to let you respond to that. You got a drug and alcohol therapist. I regard him as one of the best in the area.
Thank you.
Saying that he wouldn't legalize marijuana. What do you say to that?
I would, unpack some of the comments that you made and start with this. When we have this discussion, we seem to come at this starting point that there isn't already widespread black market distribution of marijuana products. When I was in high school in the 1980s, I could go to the locker right next to mine where the kid who had that locker was selling marijuana. He was selling Quaaludes. He was selling cocaine. Opiates really weren't around back then,
Right.
but that was my access. If I wanted a six-pack of beer, I had to find an adult who would go into a bar with his identification, buy that six-pack of beer, and then give it to me. And that adult, in so doing, committed a misdemeanor, endangering welfare of children, corruption of the morals of a minor, or purchasing that alcohol illegally for me. Here in Pennsylvania, right now, our medical marijuana program involves seed-to-sale tracking. That means that every single gram of either hash oil concentrate, every single pill, every single tincture, every single package of flour is tracked from the cultivation processor to the dispensary to the point of sale. I have to have my identification to go into that medical marijuana dispensary. Adult use dispensaries in legal states are exactly the same. You have to show that you are over the age of 21 in order to get access to the facility to make the purchase. So at the very least, in a well-regulated system, a teen would either have to obtain an illegal identification or find an adult willing to engage in illegal diversion of a legal marijuana product to then provide that to that teen. Now, obviously, it's not perfect. Teens still have access to alcohol, but my access to marijuana as a teen was far greater than my access to alcohol as a teen because I had to go to a liquor store or go to a bar in order to access that alcohol. I think that the notion that prohibition versus legalization is somehow going to increase teen access through a well-regulated system of distribution is simply not proven by what we're seeing in other states. And we are in fact seeing in other states that teen marijuana use in states that have full adult use legalization is beginning to decline, not increase. Let's look at the Netherlands, for example. They have for 40 years maybe even longer than that. It started, I believe, in the 1970s, have decriminalized marijuana and allowed it to be sold in, the famous Dutch coffee shops.
Yes, yes.
Dutch marijuana use is less than half. Dutch teen marijuana use is less than half of American teen marijuana use.
Okay.
So if there was this, correlation between relaxing marijuana laws and increased teen marijuana use, we would most certainly see it playing out in areas
In
like the
places
Netherlands,
like that, yeah.
as opposed to seeing the absolute opposite taking place.
Okay.
Well, I mean, I don't agree with that in as much as you are dealing with and addressing a totally different culture. I mean, you cannot easily compare the culture in the Netherlands to that of the
America.
United States.
Yeah.
And the child rearing component that we have here, the socialization component that we have here, is very different. And the other thing is that just like you had to go to your neighbor in the locker room to purchase, there are still plenty of friends and family members who have alcohol in their homes, because one of the things that I have found as well is that youth and young adult that do abuse alcohol, along with other drugs, very often find them in the home, just like they find legitimate prescriptions as well. And so the fact that someone's not going to be selling medical marijuana, just like they're not selling prescription opiates that they get for back pain, that's still one of those areas where we're seeing this kind of pathological use, and as well as, if you want to say it, criminal distribution. And I think that's the other thing that we have to look at is that there is a level of minimization associated to that, and some of that is very cultural. I mean, it's not uncommon. And let me use self-disclosure as a means of relating this as well. It's like, I grew up in a family where running and booking numbers was not a big deal.
Yeah.
And
yeah.
I, not having an understanding of, I'm sorry that you're really not allowed to run and book numbers because it's against the law.
Right.
And so the idea of familial rationalization of something that could be pathological or something that is illegal is alive and well, and it's alive and well in Pennsylvania.
Yeah.
And I think that I'd be kidding myself to think that people that are getting medical marijuana aren't selling it to somebody else. And
You don't know the prices of these products.
I actually do know the prices of these products. I'm very familiar with. I'm an identified caregiver in Pennsylvania. I have the ability to care for 5. I have a son who has autism, who one of his clinicians said, would you be willing to try this medication? And I had an opportunity to do that. The results were unremarkable, although I've become more and more familiar with this and how it is dispensed and distributed. The access, after I got in my car, the access was fairly easy. I saw someone who identified themselves as a pharmacist. I don't know if they were really a pharmacist.
They do. Under our law, they have to be either a physician or a pharmacist.
Okay. She certainly didn't present like any pharmacist I was familiar with.
Okay.
And then the distribution after that, because much of what I was looking to use was CBD oil more than the cannabis. I negotiated with the cashier, for lack of better terminology, and so I don't know if it's as tight as we would like to think. And for me, again, then the concern becomes, how much can I really purchase, and the negotiation around what's working and what's not working really depends upon me and how much information I present. And so we would really look for those folks that are doing this and have a really clear understanding of what their symptoms are. And does it work? I do believe it does. And have I worked with and worked with youth and young adults that have had paramotor motor agitation and a lot of stimulating behavior and anxiety? Sure, absolutely. And it has been effective for them. I don't negate that in any way. Just like other types of medication. Alcohol is a great medication.
Right.
It's fast acting, it's
Right.
easy access,
It works.
easy to take. Yeah. the unfortunate thing is you develop a tolerance, and after a while you forget what your name is. So I think that's the problem.
Right.
That's the problem. And we're leaving that control to individuals that, in many cases, I mean, current research out of Canada says that almost 30% of the youth that are using marijuana in Canada meet the criteria for a use disorder.
Yeah.
Now, I thought that when we changed that criteria from abuse to use disorder, that it would kind of refine this process. But we're seeing individuals that are meeting the criteria of a use disorder, whereas before, 18% maybe for alcohol met criteria for abuse and dependence combined.
Right.
So what does that say? What does that say about marijuana? What does that say about that process and that intake?
And that's accurate. Today in America, a 2018 study suggested that roughly 36% of 12th graders were using marijuana. And so is that concerning? I mean, is that something that we need to address? And does that change with the legalization of marijuana?
Well, again, what we're talking about here is whether or not the criminal justice system is an appropriate measure to address these societal issues. And I will continue to double down and say absolutely not, because we can look at over 40 years of marijuana prohibition and see that it has been an abject and utter failure. So why are we continuing to use the criminal justice system to try to talk about these issues? Now, as far as, is it a concern? Yes, anyone that has a substance use disorder and whose life is adversely affected by that has other issues that need to be dealt with. If every single day I need to eat 10 cheeseburgers before breakfast, that's an issue, even though cheeseburgers are 100% legal. I am clearly, coping for something else. And doctor, something that you just said, yes, marijuana can be a very effective treatment for anxiety. Yeah. Are our youth having issues associated with anxiety, associated with depression? I mean, I live in the city of Pittsburgh, and in my opinion, some of the young people who every single day go to school afraid of whether or not they're going to get violently robbed for their shoes or for their cell phone or for whatever, to me, those young people are dealing with an incredible amount of stress. Young people who've seen their friends and family members killed in certain neighborhoods. Those young people are under a considerable amount of stress. No one's talking about that. No one is talking about what are the root causes for someone to say, hey, I'm 17 years old, and if I don't get high every single day, I'm going to crawl out of my skin. I'm not suggesting that that 17-year-old's daily use is appropriate. It may be, it may not be. However, to say that we need to criminalize that individual's use of cannabis, that we need to subject them to the 17-year-old to the full treatment of the juvenile justice system, or as soon as that individual turns 18, the potential for prosecution and conviction. And with all due respect, doctor, even a misdemeanor small amount of marijuana conviction in Pennsylvania is something that stays on your record for the rest of your life, can result in the loss of economic opportunities, the loss of public housing. We're about to end the ridiculous driver's license suspension for a small amount of marijuana, but until April, you're still subject to a minimum 6-month driver's license suspension and fines of $500 under Pennsylvania's law, the cost of court, the need to hire an attorney. This is absolutely and utterly ridiculous when we see that other states are engaging in full legalization, bringing tax revenue to help with, among other things, teen drug education, and to have a better conversation about the risks of teen drug use, as opposed to saying it's illegal, you can't do it, period, and if you do, we're going to drop the entire weight of the criminal justice system on your head. That's absurd, and I would submit, I am not a teen mental health professional by any means. I'm a criminal defense attorney, but I would submit that when you tell a teenager, they're absolutely prohibited from doing something that is going to trigger their increased interest in engaging in that activity. And that's why I would submit that we see teen marijuana use in legal states, statistically starting to decline. The taboo is gone. It's no longer interesting. It's no longer sexy. You're not a rebel for getting high when you're in high school. You're doing something that your grandparents do because they have chronic pain.
And I want to clarify. I misspoke. 36% of 12th graders in America right now have smoked in the last year. The daily use is much lower than 36%. And I think it's important to have.
It's a significant distinction.
No, right. Those are important things. The details matter. And I do like what you said. It's important to recognize that the issue of criminalization of cannabis is a separate issue from substance use disorders, because we can address both separately. We can address the idea that we need to figure out why these teens are exhibiting these symptoms of substance use disorder and what can we do to help them. But we can also recognize that the criminalization of cannabis has had significant cultural impact on certain communities and doesn't make sense anyway. I mean, at least in my opinion, criminalization of marijuana doesn't make any sense, and it has been weaponized in America.
Oh my God, yes.
And so it's important, I think, that we recognize those things. And we could go on forever about this, but I appreciate the conversation we were having, but I'm going to challenge you here. We got a little lightning round. I'm going to ask a question. I need your answer. It's the first answer that pops into your mind. Okay, so you come home and you find your 15-year-old daughter in her bedroom with her boyfriend. Would you rather she is having sex, drinking alcohol, or smoking marijuana?
Doctor?
I would rather she's drinking alcohol.
Consuming cannabis.
That's a tough one. I'm going to try to answer myself, and honestly, I wrote the question, and I don't know what my answer is.
But I would. My only caveat would be that the cannabis use is not what concerns me. It's the risk of the criminal justice system interfering in her and my life that concerns me.
You mind that it's illegal that she's using?
Yes. Between those three activities, in my opinion, the least risky of those activities is consuming cannabis.
And would there be any consequences associated to this usage, regardless of what she was doing? And I would say yes. In my house, there would.
In your house, there'd be consequences.
Absolutely.
To the cannabis use.
Everything.
To all of them. Okay.
Yeah, certainly. That's a different issue. But
Okay.
presented with which is the worst
Which
or
one
the
is-
best of the
right.
three.
I actually agree. I would choose cannabis.
That's me laying down the law in my home.
Right,
And so
right,
now we're talking
right.
about the legal system.
Right,
What are the
that's a good
consequences?
point.
So
There's
do
a
we need to
difference
change the
there.
consequences, perhaps?
All right, last question. Here we go. Who would you rather smoke with? The Pope, President Trump, or your teenager? Patrick, you go first this time.
I would love to burn one with Donald Trump. I would do
Really?
anything. Absolutely. I mean, if that is a realistic possibility that we're
Right.
bringing into
Right.
the picture, I think it would be absolutely
With the president.
and utterly fascinating.
Okay, Doctor.
Who would I rather smoke with? You know, is there an option that I don't smoke?
Well, they can smoke. You don't. You're in the room, but you don't smoke.
Oh, it'd be the Pope.
The Pope.
Oh yeah, the Pope ripping, twisting a fatty,
Right,
and blowing
right,
one there.
right.
I can't wait to hear what he has to say.
But allow me to make one comment, and
Sure.
I think this, follows up on the, taking the stigma or that taboo away from marijuana consumption. I have a 17-year-old daughter. She's graduating and will be going to Chatham. I have a 13-year-old son, and I have an 8-year-old stepdaughter. I have been a cannabis activist and reform activist since 2009. I met my wife in 2012, and she is a fellow activist, and we are both medical cannabis patients. Our children have expressed absolutely zero interest in cannabis use. They've expressed no interest in alcohol use, no interest in tobacco use. But significantly, we have a house where we have medical cannabis products that are securely stored. But we have absolutely no concern that if my 17-year-old daughter is home at our house alone, that she's going to be trying to get into these products. They just have no interest in it. I remember talking to Keith Stroup, who was the founder of the National Organization for the Reform of Marijuana Laws,
Okay.
and he said the exact same thing about his kids. They had zero interest in cannabis because it was normalized, it
had
was
been
in their face
normalized
every
Yep,
single day,
yep.
and they just said that's not for them.
We have a word that we use in drug and alcohol treatment. We say yet.
Yeah.
And I think that, I do understand that when some of the mystery is taken away, that can have an impact upon someone's usage. And I also believe that access can also have an impact upon someone's usage or desire to try.
Yeah. Well, there you have it. Great conversation. I want to thank our guest, Dr. John Masella, and
Thank you.
Attorney Patrick Nightingale. If you have any more to say about this issue, please come visit us on Facebook, Dr. Rueben Brock, and let us know what you think about this issue. And let us know what you want us to talk about next. But for today, that's all we've got. I'm Rueben Brock. This is House Call. Hey everyone, I wanted to take a second and show you something that I think a lot of parents don't know. Research suggests that the fastest growing trend in substance use right now is vaping. And parents might not realize that you can actually vape cannabis or marijuana. And so I wanted to show you what you would be looking for. It's important that parents recognize what their kids have and that the possibility exists that there is marijuana being used. So this is a typical vape pen or e-cigarette, and so it has a cartridge, and it is possible to get a cartridge that has cannabis oil in it. And the most popular thing right now is a Juul. This is a Juul, and so as you can see, it is something that you probably wouldn't even recognize. If you see this in your kid's book bag, you'd think maybe it's a thumb drive of some kind. And these things are marketed as just a typical e-cigarette. You can get nicotine in this, you can get pure flavors in it that don't even have nicotine, and so kids can smoke this. But it is possible. People have started to figure out how to modify these and get cannabis oil and cannabis wax into these cartridges, and you put them in here, and then it goes into there and charges up in a USB port. So it is important, if you see these things, to at least consider the possibility that your child could be using this for marijuana purposes. And so don't make the assumption when you see these things that they are a thumb drive or something they're using for school. It could very well be drug paraphernalia. It's possible that it's not, but I wanted parents to be able to recognize these things when they see them. And that's all we've got for today. Special thanks to Dr. Masella and Attorney Nightingale. And for House Call, I'm Dr. Rueben Brock.